#1. Best at-home test to find clogged arteries. You know, there are people who wake up in the morning, make coffee, take the dog for a walk, check their blood pressure and see if it's normal, and then, just a few hours later, collapse in the bathroom. No warning signs, no obvious pain, and by the time the ambulance arrives, it's already too late. The question isn't, why did they pass away, but why didn't they know beforehand? You've checked your blood pressure before? Good. Do you eat a healthy diet? Even better. But have you ever truly known what's going on inside your arteries? Could there be a plaque silently building up like a small, hidden time bomb just waiting for the day it explodes? There's a simple way to find out. No expensive tests, no doctor's visit required. A test you can do right at home with nothing more than a blood pressure monitor. Sounds like a joke? In fact, this is the very method many top cardiologists use to detect plaque early, before it's too late. And if you're still thinking, I feel fine, I probably don't need to check, then you're exactly the person who should listen carefully to what comes next.
Why plaque is dangerous and you don't even know it. Imagine you've just left a cardiology clinic. The doctor glances at your blood test results, sees your cholesterol is a bit high, and hands you a prescription for statins. No detailed explanation, no questions about your symptoms, no discussion about the state of your arteries, whether there's anything abnormal happening inside. You walk out holding that prescription, with a head full of unanswered questions. Have you ever been in that situation? The real question we should be asking is, why is the doctor so focused on cholesterol? Because they believe cholesterol is the main cause of blocked arteries, right? But that's only the tip of the iceberg. What few people tell you is that what truly causes a heart attack isn't just cholesterol. It's something medicine calls plaque buildup, an accumulation inside your arteries like a stubborn, ongoing inflammation. Are you picturing it as a thick layer of hardened fat stuck inside your arteries? Not exactly. The truth is, plaque is more like a sticky, soft, inflamed gel, extremely fragile. It's like a pimple ready to burst. Just a slight trigger, and all the inflammatory material inside spills out. And when it does, what happens? Your body reacts by forming a blood clot. If that clot travels to the heart, you have a heart attack. If it goes to the brain, that's a stroke. Do you see the irony? Someone who walks every morning, eats a healthy diet, can still have a stroke because of a tiny piece of plaque they didn't even know existed. And the simple reason is this. Plaque often causes no obvious symptoms. It quietly grows, day after day, until it's too late. It's frightening to know that according to research from the National Heart Institute, over 40% of people who suffer a first heart attack had no prior warning signs. No chest pain, no unusual fatigue. They were just living life as usual until there was no next day. So how can you know if you're carrying plaque if it doesn't show itself? How do you detect this invisible monster before it erupts? Have you ever measured your blood pressure? If you have, you already own the very tool that could help you answer that question. In the next part, I'll show you how to use your home blood pressure monitor, the same kind you or your loved ones may use each morning, to check whether your arteries might be narrowing or blocked. A simple test, no doctor required, but one that could save your life. Do you want to know how to do it?
2. ABI, the at-home test to detect plaque. You've measured your blood pressure at your arm before, right? But have you ever tried measuring it at your ankle? You might be thinking, why measure at the ankle? And that question is exactly why millions of people miss the chance to detect plaque early. Because in reality, measuring your blood pressure at both the arm and the ankle, and then comparing the two results, is a method many cardiologists rely on to see if your arteries are narrowing or blocked. This method is called the ankle brachial index, or ABI for short. So what is ABI? It's simply a division. The systolic blood pressure, the top number, at your ankle, divided by the highest systolic reading from either arm.
If the blood flow to your legs is weaker than to your arms, it suggests there may be a blockage in the blood vessels in the lower part of your body, and the usual culprit is plaque buildup. I know you might be thinking, that sounds complicated, I'm not a doctor. But it's not. You can absolutely do this at home. All you need is a common electronic blood pressure monitor, a sheet of paper to record your results, and 10 quiet minutes. First, lie down and rest for a few minutes to stabilize your blood pressure. Then, measure your blood pressure in both the left and right arms. Write down both results. Next, remove the cuff and wrap it around your ankle, positioning the inflatable part over the artery along the inside of your ankle bone. Measure your left ankle and right ankle in turn. Record all the systolic readings, the top numbers, which usually appear before the slash mark. Now it's time to calculate. Take the highest systolic pressure from your ankles and divide it by the highest systolic pressure from your arms. For example, if your ankle reading is 126 millimeters of mercury and your arm reading is 114 millimeters of mercury, 26 divided by 114 equals 1.1. That's your ABI. You can repeat this calculation for your other leg, one number per leg. And if you're wondering, what number should I expect? The answer lies in scientific research. According to a meta-analysis published on PubMed in 2021, the ABI test has a specificity of up to 87%, meaning if your ABI is low, there's a very high chance you have narrowed arteries. If your ABI is normal, you should still check periodically because the test's sensitivity is not perfect. In other words, ABI is excellent for detecting more severe cases, but it's not a complete replacement for medical evaluation if you already have suspicious symptoms. The Mayo Clinic also calls ABI an accessible, low-risk, and reliable tool for screening peripheral artery disease, a clear sign of plaque buildup. And if you think this test is too simple to be effective, remember, many cardiologists still use it to quickly assess the risk of heart attack and stroke. The question is, will you actually do it? Or will you wait until you feel pain, numbness, or fatigue, symptoms that often appear only when things have become serious? So after you measure and see results like 0.95, 1.1, or 0.75, how should you interpret those numbers? When should you feel reassured, and when should you act immediately? In the next part, I'll show you exactly how to decode your ABI results number by number, so you'll know whether you're in the safe zone or the danger zone.
3. How to interpret ABI results, when it's normal, when it's a warning. Let's say you've just finished measuring. Your arm reading is 114, your ankle reading is 126. You divide 126 by 114 and get 1.1. You breathe a sigh of relief. Looks fine, right? But what does that number actually mean? ABI, or ankle brachial index, is a sensitive measurement. It doesn't just reflect blood pressure, it reflects how well blood is flowing through your arteries. And like any medical index, it has a well-studied reference range. If your ABI is between 1.0 and 1.4, that's a very good sign. It means the blood pressure in your legs and arms is almost the same, indicating normal circulation with no obvious narrowing or blockage. This is the green zone, the healthy zone. But one thing to remember, a normal reading doesn't mean zero risk, especially if you're in a high-risk group, over 60, a smoker, diabetic, or with a family history of stroke. If your ABI is from 0.9 to just under 1.0, there are early signs of mild narrowing. This is the orange zone, still okay, but requiring close monitoring. Plaque may be starting to form, or there may be slight stiffness in the arteries. You don't need to panic, but you also shouldn't ignore it. This is the perfect time to make lifestyle changes, because you still have time to reverse the process. If your ABI is below 0.9, that's the red zone. Your arteries may already be significantly narrowed. Blood flow to your legs is being restricted, and that means a very high likelihood you have plaque somewhere in your body. At this point, you're not only at risk for leg pain when walking, but also for blood clots, stroke, or heart attack if the plaque ruptures. This isn't just theory. A study published in the Journal of the American College of Cardiology found that an ABI below 0.9 is directly linked to higher mortality from coronary artery disease and stroke. In other words, a small number can reveal a huge risk. And don't forget one detail most people overlook. If your ABI is above 1.4, it doesn't mean you're extra healthy. On the contrary, it could mean your arteries have become so hardened that they can't be compressed during the test. This is also dangerous because stiff arteries lose elasticity, blood isn't distributed effectively, and other organs are more easily damaged. Now you see, every number carries a warning. But are you truly hearing the message your body is trying to send? Ask yourself, which zone is my ABI in? Am I taking action early, or am I waiting for a clearer sign, one that might come too late? If you're in the safe zone, congratulations, but don't stop there. Use it as a baseline for regular monitoring. And if you're in the danger zone, take action, starting today. But wait, you might still be thinking, I feel healthy, I walk regularly, I eat well, surely I'm not in the risk group. In the next part, I'll explain why people over 60, no matter how healthy they feel, are actually the group that needs ABI testing the most.
4. Why people over 60 need this test, even if they feel healthy. I once met a 66-year-old man. He told me, "Doctor, I walk every day, eat healthy, don't smoke. I'm sure I'm healthy." 3 months later, he was admitted to the hospital with a mild heart attack. When I asked him when he last had an ABI test, he said, "What's ABI?" This story is not rare. Many people over 60 believe that as long as they have no symptoms, they are healthy. But did you know that nearly 50% of people with plaque buildup feel nothing until it causes a major event? The reason is simple. Our bodies, especially as we age, start to adapt to abnormalities. You get a bit winded climbing stairs? It's just age. Do your legs feel heavy after a long walk? Must be the shoes. But those subtle changes are silent warning signs, and if you ignore them, you might miss your last chance to prevent something far worse. Have you ever felt this way? In the comments I've read, one stuck with me. "I'm 65, not on any medication, but I'm a little worried. My father died of a stroke at 68. That's the unspoken fear. Wondering if you'll follow the same path as your parents, because you have no control over what's happening inside your body. And then there are people like Judith, 74 years old, still walking every morning, drinking green tea, eating plenty of vegetables. But when she took an ABI test, her number was 0.84, meaning there was already arterial narrowing. She said, "I didn't feel anything at all. If I hadn't done this test, I would never have known." Do you see yourself in these stories? The most dangerous thing about aging isn't disease, it's complacency. It's the feeling of, "I'm still fine." But the truth is, plaque doesn't care how you feel. It just needs enough time to build up, and one day, it ruptures. That's why people over 60, even with no symptoms, are the group who should get an ABI test the most. Because you're at the stage where plaque can start forming without leaving any trace, and if you catch it early, you can completely change the game. Research from the Mayo Clinic also emphasizes that ABI is a simple, low-cost, non-invasive way to detect peripheral artery disease, a sign of early, system-wide plaque buildup. And the American Heart Association calls ABI a window into the health of your entire vascular system. Do you want to know your true condition before it speaks up in the most devastating way? If your answer is yes, then you already have the tool in your hands. The blood pressure monitor you use every day can become a life-saving device if you know how to use it correctly. And if you've already measured, if you already know your ABI is 0.95 or 1.1 or even 0.8, then the bigger question is, what will you do next? That's when we move to the next step: how to reduce plaque buildup, prevent complications, and live longer without necessarily depending on medication.
Do you want to know how I and many of my patients have done exactly that?
Act before it's too late. Maybe for years you've done everything right. Eaten less salt, walked every day, monitored your blood pressure regularly. But there's something that could have been silently happening inside you without your knowledge until it announces itself in the harshest way. Remember the question from the start of this video? Do you have plaque inside your arteries? Now you no longer have to guess. You can check, by yourself, right at home. No one knows your health better than you, if you're willing to face it. What I want you to realize is this: a simple number like ABI can help you reclaim control over your health. It doesn't replace your doctor, but it gives you the initiative. It gives you the chance to know early, so you don't have to say, if only, when it's too late. If your number is good, I'm happy for you, but don't stop there. Keep monitoring it regularly. Make it part of your routine. And if your result isn't good, don't panic. Be glad you know, because knowing today means you still have time to change. You still have the chance to protect your heart, your brain, and the life you love. You're at an age when many people start to slow down, but don't live carelessly. Every minute you act early is another chance to live longer, healthier, and freer. If you've ever done an ABI test, share your number in the comments below. And if you haven't, do it today. You might be standing at a turning point without even realizing it. And if you want to know how to reduce plaque, clean your arteries naturally, and lower your stroke risk without relying on medication, then the next video is something you won't want to miss.